Hi, this is Erin Ramos. This presentation will be focusing on medications used for acute bacterial pharyngitis. I will be introducing the general concept of acute pharyngitis in the next slide and later go into detail on the medications for bacterial pharyngitis. This was inspired by a documentary I watched called The Waiting Room. It had various patient perspectives of being in an emergency waiting room, hoping to be seen soon in a highly populated hospital. One of them was a 10 or 11-year-old child with severe swelling in the tonsils and pharynx, who was later diagnosed with strep throat. And strep throat is is also known as bacterial pharyngitis. So going into acute pharyngitis, this is the inflammation of the pharyngeal walls, tonsils, palate, and uvula. This infection can be caused by a virus, bacteria, or fungus, but I will focus on viral and bacterial infections. Diagnosis of acute pharyngitis depends on whether the infection was caused by a bacteria or virus. If the patient presents with 2 or 3 of the bacterial manifestations, like a fever greater than 104 degrees Fahrenheit, an absent cough, exudate, and swollen lymph nodes, then a rapid antigen detection test and/or a throat culture can be done and help with diagnosis. You tend to see a scratchy throat and painful swallowing with viral pharyngitis. To assess for viral pharyngitis, a monospot test may be used to help diagnose the infection. The monospot test tests for the Epstein-Barr virus, or EBV. If the test is positive, then it indicates that the patient is affected by EBV. However, a patient can still have mono and a negative test if they are affected by a different virus, like CMV or cytomegalovirus. Once diagnosed, we can focus on infection control, symptom relief, and prevention of secondary complications for these infections. In the next slide, we will focus on antibiotic medications used for bacterial pharyngitis. So, these are the medications used to treat bacterial pharyngitis caused by group A beta hemolytic streptococci, a gram-positive bacteria. Before I go into detail about each one, I will touch on viral pharyngitis treatment. Antibiotics are not recommended for viral pharyngitis. We can recommend the patient to use ibuprofen or acetaminophen for pain relief. Educate the patient to increase fluid intake. And as for symptom relief, we can educate the patient to gargle with warm salt water, drink warm or cold drinks, and use throat lozenges. Now, looking into penicillin, specifically focusing on natural penicillins such as penicillin G and penicillin VK. These medications are indicated for gram-positive bacteria. These can be also used for dental infections, UTIs, and other upper respiratory infections. Penicillin will bind to penicillin-binding proteins and inhibit peptidoglycan, which interferes with normal cell wall synthesis. Defective cell walls are formed, which causes lysis of the bacterial cells. Now for dosing. Penicillin G is administered as an IV or IM form, and penicillin V is administered as a PO form only. The IV forms of penicillin, like penicillin G, contain large amounts of sodium and/or potassium, so doses must be adjusted for patients with renal dysfunction. As for penicillin V, it must be taken on an empty stomach 1 hour before or 2 hours after meals. Next, we can look at clindamycin or Cleocin, a semi-synthetic antibiotic. This can be used if the patient is allergic to penicillin. This medication has a black box warning of pseudomembranous colitis or C. diff diarrhea, a necrotizing inflammatory bowel condition. Gram-positive bacteria are mostly susceptible to clindamycin, but there are several anaerobic gram-negative bacteria that are susceptible to the medication as well. Other indications of Cleocin include sepsis, pneumonia, osteomyelitis, and more. This medication can be bactericidal or bacteriostatic, depending on the concentration of the drug at the site of infection and depending on the bacteria. This medication can inhibit protein synthesis in the bacteria by preventing peptide bond formation within the cell. The adverse effects include C. diff, hypersensitivity reactions like anaphylaxis, urticaria, and nausea vomiting. Clindamycin has neuromuscular blocking properties that may enhance the actions of neuromuscular drugs, and it may also exacerbate ulcerative colitis and enteritis due to causing adverse effects in the GI tract. Lastly, we will talk about azithromycin or Zithromax, a macrolide antibiotic. This is another medication that can be used if the patient is allergic to penicillin. Besides affecting S. pyogenes or group A beta hemolytic streptococci, this medication can be used for STIs, COPD exacerbation, mycobacterial infection, or MAC infection, as well as pelvic inflammatory disease, skin-to-skin infection, and urethritis. Zithromax is a bacteriostatic medication that inhibits RNA-dependent protein synthesis. Adverse effects of this medication include QT prolongation, C. diff, hepatotoxicity, and ototoxicity. Thank you.